Thank you, Chairwoman DeGette. We're here today to conduct oversight of the Medicare Advantage program. Nearly 27 million seniors are enrolled in Medicare Advantage plans, which is run by private health insurance companies. And while the program offers seniors flexibility in the way that they receive their medical care, it's important that we ensure that Medicare remains financially viable and that seniors are receiving the high quality care that they deserve. Now, I am deeply concerned with recent reports that seniors in private sector Medicare Advantage plans are facing unwarranted barriers to accessing timely medically necessary care. Several studies have raised concerns that insurance companies are denying beneficiaries access to treatment and imposing burdensome requirements that delay care. Improper claim denials and increased use of prior authorizations are preventing beneficiaries from receiving the care that they need. Now, while most plans appear to be acting responsibly, some are not, and these bad actors are costing taxpayers money and, more importantly, jeopardizing the health care of seniors. This oversight hearing is critical to ensure that we're protecting the health and well-being of Medicare beneficiaries, and it's also important to determine whether Medicare Advantage is providing good value for our federal dollar. When Medicare Advantage was created, the hope was that private sector efficiencies would reduce the cost of care for seniors. Unfortunately, that has not been the case. In fact, the Medicare Payment Advisory Commission, one of today's witnesses, has consistently found that providing care under Medicare Advantage has cost more than under traditional Medicare. Studies have repeatedly found that some Medicare Advantage plans, particularly the larger ones, receive greater compensation from Medicare without necessarily providing better healthcare services to beneficiaries. In short, some insurance companies appear to have figured out a way to game the system. Now, this is in large part due to the way we reimburse Medicare Advantage plans. Those plans receive more money from the federal government based on various factors, including the underlying medical risks of the individual enrolled in the plan. To ensure they receive more money, insurance companies use tools like in-home health risk assessments to claim that individuals on those plans have additional health conditions that their provider has not formally diagnosed them with. And this allows the plans to claim that beneficiaries are in riskier health, and therefore the plans receive more funding from Medicare. But as today's witnesses will help explain, those new diagnoses do not always reflect reality. Additionally, seniors that receive these new diagnoses from insurance companies rather than their doctors do not always then receive the healthcare services for those diagnoses. So this phenomenon is called coding intensity, and it suggests that some plans are focusing their efforts on finding ways to pad their profits rather than ensure seniors are receiving appropriate care. So we'll hear a great deal today about coding intensity and what can be done to put a stop to it. One benefit to enrollees under the Medicare Advantage program is that plans use portions of their funding to provide supplemental benefits beyond what traditional Medicare offers. And these supplemental benefits can include transportation to and from appointments, nutrition planning, memberships for fitness centers, or dental coverage. These supplemental benefits can certainly provide real positive impacts for seniors, but there has not been any meaningful accounting about whether or not seniors are actually using these services and if their usage correlates to the additional money insurance companies are being paid. So as Medicare payments for these supplemental benefits continue to increase, we must better understand if they are helping seniors and whether they're being delivered at a reasonable cost. We simply need more transparency and reliable data from the insurers to make sure that taxpayer funds are benefiting seniors and not the insurers. America's seniors expect and deserve high quality health care. We must ensure that is what they're receiving. I thank the witnesses for being here today as we conduct important oversight of the Medicare Advantage program. I know many of us, both Democrats and Republicans, that are part of this subcommittee today, Madam Chair, including yourself, have always been trying to expand services for seniors and, looking out for seniors. Some of you are on the task force. I think that's Jan and also Doris Matsui that is constantly bringing to my attention and to the Congress's attention, what we need to do to protect seniors. So this is an important part of that. And I thank you, Madam Chair, for doing this today. I yield back.